Hello, I'm Tamara Camo, and I'm a board certified gynecologist. And I'm talking to you today about natural ways to enhance your fertility. I will begin with a list of some of the things that you might not have thought about could be impairing your fertility. And you can feel free to employ some or all of my suggestions. So, essential oils are amazing to heal the body and the mind. When the body is disrupted, it's difficult to get pregnant. If you're stressed out, it's difficult to get pregnant. If you don't get enough sleep, that can impair your ability to get pregnant. So there are many things. I'm sure you've read that you should eat right and take vitamins and do certain things, but I'm also going to include things that you might want to do less of. Some of the questions you need to ask yourself. So we clean our house with toxic chemicals. Can these chemicals be found in the baby's cord blood? And the answer is yes, they can. So the first thing you want to do is take inventory of some of the things you use to clean your house. And maybe you want to use vinegar or use a more natural solution that you can find at the grocery store. And I will also give you some products that I find important. Number two, we use cosmetics, perfume, and deodorant that have chemicals in them on our bodies. Can these chemicals be found in the baby's cord blood? I will say that yes, they can. The average woman puts between 160 and 200 different chemicals on her body every day. Before you walk out the door, you have put lots of chemicals on your body. And if we take a newborn baby and examine its blood, many of these chemicals are found in the baby's cord blood. Can these chemicals be interfering with reproduction? We don't have any articles that prove that. It just seems that we would not want these items in our baby's cord blood. Prior to even conceiving is a good time to start changing your regimen so that when the baby is born, instead of 200 things, there could be many less things in the cord blood. Number three, we eat inflammatory foods, and inflammation is not favorable for normal cellular development. Can we reduce this? So, this is where essential oils become important, and we certainly can influence this. And I will give you some strategies on how to decrease inflammation. It's not just the food. One of the things we already discussed about the toxic chemicals that you clean your house with and the toxins you may put on with your personal care products that also can lead to overload and inflammation. All of those things together have a big impact. Number four, do we eat the amounts of fruits and vegetables recommended in a healthy diet? Are there ways to supplement this? So, when I question people, many people say they eat 7 to 9 servings of fruits and vegetables a day. And definitely, there have been lots of studies that the components found in fruits, especially when you eat many colors of your diet. Everything can't be green. Even though green's really good for you, you want purple, you want yellow, you want red, you want orange, you want to eat the rainbow all the time. And many of us don't. And there are some ways we can supplement to add to the variety of our diet and maybe replace some nutrients that we are lacking. And some of those nutrients may be important for fertility. Number five, do we have the enzymes and probiotics necessary for optimal digestive function? So, you've heard the saying, you are what you eat, but actually, you are what you eat and absorb. So, if you eat a steak and don't break it down properly, you don't get all of the nutrition from that steak. So even though you ate it and you think you're okay, sometimes having a healthy gut, eating enough enzymes, having enough probiotics, having the right bacteria in our gut is very advantageous for general health, and definitely the healthier you are, the better your fertility could be. Number 6, omega-3 has been studied for brain development. Am I taking enough? Well, many people are not taking a supplement, and I find that when I do diet inventories with people, just out of a regular diet, most people aren't getting enough. If you were someone who ate mostly fish or on a Mediterranean diet, you have a better chance of eating enough. But if you eat more steak and potatoes and pork and chicken, you're not probably getting a lot of omega-3. And if you've ever read, omega-3 is very important for the baby's brain development. So you definitely want to find ways to get omega-3 into your diet prior to conceiving. And also, their omega-3 lowers inflammation. We already discussed inflammation in number 3. So that's one of our tricks for lowering inflammation, is making sure we get enough omega-3 in our diet. And if not in our diet, add a supplement. Number 7, how can I safely optimize my baby's DNA? The baby's born with chromosomes, but many things you do while you're pregnant alter the baby's chromosomes. Let's say you ate a ton of sugar while you were pregnant. Sometimes this switches genes to unfavorable configurations. So you definitely want to eat healthy while you are pregnant. Also, being very inflamed and stressed is not favorable for your DNA nor your baby's DNA. So you definitely want to do things that help with inflammation and stress. Even the chemicals could possibly have an influence on the DNA. So basically, after you handle 1 through 6, number 7 takes care of itself a bit. And number 8, do we take enough vitamin C or antioxidants to address cellular stress? That is hard to quantify. I would have to say no. If you're not supplementing with vitamin C at all, every day we don't necessarily get enough vitamin C in our diet. And even if you're getting the recommended daily allowance, you might need more vitamin C. So we will discuss how to optimize our vitamin C levels. So that's just some of the questions that you may not have thought about yet. The toxins, the inflammation, the stress, and how all of these things that you can't walk in the doctor's office and have them just draw your blood and tell you, do I have toxins? How much inflammation? There's a lot of things we can't quantify. I can't tell you how many enzymes are in your body right now, or I could tell you about your gut flora, but that's more testing that is done. But in general, it's just good to make sure you are doing your part and not doing something that negatively affects you. Maintaining fertility is not just about getting pregnant. Our reproductive system ages faster than any other system in the body. Men retain their ability to reproduce forever, and women don't. We have an expiration date on that. So, how quickly or slowly your reproductive system ages will impact your fertility and your ability to get pregnant later in life. So, you want to make your body healthy enough to carry a baby. You want your fertile years to last longer. And so, you want to be proactive about that. What kind of diet would we want to eat while we're pregnant or before we're pregnant? And actually, ideally, the same diet. You don't want to have to pick a diet now and then pick a new diet when you get pregnant. So I currently am a gynecologist, but I, in the past, delivered babies. And I did not have my patients on calorie restricted diets. I didn't say eat 1,500 calories or 1,800 calories or any particular calorie. I would steer them towards maybe a diabetic diet, because diabetics limit the amount of sugar they eat, but they don't have a limit on the amount of food they can have. Or maybe a South Beach diet, which pays attention to healthy carbs and not junk. Or the Mediterranean diet. Now, as far as research and fertility goes, the Mediterranean diet has the best research. So I like Mediterranean diet in pregnancy. I like Mediterranean diet preparing for pregnancy. And there's actually a lot of study on the Mediterranean diet in both cases, whether you're pregnant or not, it's a good diet because it mostly focuses on fresh fruits, fresh vegetables in the Mediterranean. So if you're in Greece, there's lots of seafood and olive oil. There's just many things in that diet that are really nutritious for the baby, very nutritious for health, and it's anti-inflammatory. Also, if you read the book, The Blue Zone Diet, the blue zones are the 5 areas in the world where people live longer than everyone else. Greece, Okinawa, Japan, Loma Linda, California. There's just a variety of places where people eat a particular way that helps with longevity. So definitely this would be important when it comes to protecting your baby's DNA. Google the Mediterranean diet. It's not difficult to do, and just start incorporating some of those things into your life. The Mediterranean diet during pregnancy was shown to epigenetically reduce a child's risk of disease. So genes are what the baby's born with. Epigenetics is how you influence those genes. You can eat a lot of sugar and have a lot of stress and influence those genes in a negative fashion. And you can lower the inflammation in your body and eat a particular diet and alter those genes in a beneficial fashion. I have a study here, nutrition during pregnancy impacts offspring's epigenetic status, evidence from human and animal studies. So we know that what we do prior to and during pregnancy has an effect. Just like smoking. Why do we tell people not to smoke? Cigarettes are not favorable for your DNA. So if a person is smoking, it's not just their health and their lungs that they're affecting. It's also not favorable for the baby's genes. And it's inflammatory. Smokers deplete more vitamin C. Pre-pregnancy detox. I don't really believe in like detox, like, oh, it's a 2-week detox or a 1-month detox, and then I'm all set. Before you get pregnant, this is what you're going to detox and try to stay this way. You're pregnant for a year, so it might take you a few months to get pregnant. So this is a long-term, it's not a temporary thing, it's long-term. So the first thing that we're going to make sure we do is drink at least 8 ounce glasses, so 64 ounces of water a day, like a normal amount of water that you already should have been doing. This is not new. Number 2, my other suggestion is more superfruit juices. So if you do drink juice at all, pomegranate juice is something that has a lot of, it's purple, it's got a lot of polyphenols. You don't have to drink a lot of pomegranate juice. Maybe take an ounce and add it to your water. Or Ningxia Red is a superfruit blend that I like. It has goji berries, which like are a big fruit in China. A lot of people have seen little goji cherry snacks, little chocolate covered goji cherries. It's got blueberries in it. So it's got all of these different super fruits. And maybe you could take Ningxia Red and add it to some carbonated water and make yourself a little drink out of it. You don't have to just eat your 7, 8, 9 servings of fruits and vegetables every day. You can use different things to boost it and definitely add to your hydration. Number 3, eat a high fiber diet. Not even high fiber. If the average person needs 25 to 30 grams of fiber a day, most of us only get 15. So I don't mean high fiber, like go over what you're supposed to, but make sure you're getting that 25 to 30 grams of fiber a day, because you know what it does? It helps your colon. And what's in your colon? Toxins. You want them out of your body. Going to the bathroom every 3, 4, 5 days and having those toxins stay in your body doesn't seem helpful for fertility or pregnancy. You want them out. Fiber is a great way to help them get out and make your colon more healthy. Exercise at least 30 minutes a day. This exercise can be walking, but you want to circulate oxygen and nutrients throughout your body and get in the habit of walking. So when you're pregnant, you can maintain your body weight the way you would like and be more comfortable throughout the pregnancy. Number 5, eat a wide variety of healthy foods, fruits, vegetables, whole grains. If you eat dairy, make sure it's very, hormone free, fat free, antibiotic free, or try now to start switching to non-dairy things. You can start drinking almond milk and then you don't have to worry about the hormones in the milk, or start drinking flax milk. That'll give you more omega-3. So different things like that. Choose organic foods when you can. If you eat meat, make sure it's wild caught and wasn't fed antibiotics. Make sure your meat is coming from a good source. Balancing your pH. You can take a supplement that helps you become more alkaline. You don't want to be very acidic. That is not healthy. You want to be more alkaline. Eating a lot of fruits and vegetables, especially green vegetables, or taking a green vegetable supplement, things like that. So you want to start being mindful. Even just the Mediterranean diet makes you more alkaline than eating carbohydrates. Use enzymes to encourage your healthy food breakdown. If you've ever been to a store and seen probiotics at the store, the digestive enzymes are usually next to the probiotics. Sometimes enzymes, though, at the store have wheat or dairy or other things in them that I don't encourage people to take. So I will give you the enzymes I take that don't have any of these things in it that I don't want. You want to take prebiotic things. You can eat more yogurt, kefir, and then also yacon syrup. It's a sweetener. It tastes sort of like molasses, and it's been studied to help the growth of bifidobacterium and does not negatively affect the intestinal microflora. A lot of artificial sugars and actual sugar can rearrange your gut flora in an unfavorable fashion, and you don't want that to happen. Jerusalem artichokes and yacon are the two highest vegetable sources of fructooligosaccharides, which are prebiotics that encourage healthy growth of your flora. Why would we use essential oils to support our fertility journey? Well, essential oils are used as a natural or holistic remedy for various ailments. They're not meant to replace medical treatment, but they can complement many things. Let's say that you're taking something for migraines every day. You don't want to be on this thing when you get pregnant. So it's good to start trying to, well, first of all, if you change your diet the way we previously discussed and improve your gut flora the way we previously discussed, that could help many of the things that are going on with you. But there are definitely oils that can help us get healthy faster where we don't need as many medications. Some of the things that I think of, sleep is very important for fertility. Maybe you would find a calming essential oil or blend to help you get better quality sleep. Something that simple could help you. Some women have menstrual irregularities because they're either estrogen dominant or low in progesterone. So using wild yam oil might help you counterbalance some of that. Some women suffer from mood issues, and maybe you either take something for those mood issues or you just deal with them in silence. Sometimes eating healthier, which we've already discussed, can help, but even meditating, doing yoga, or using essential oils that are calming or remind you of something happy could help you deal with the stress that is plaguing you. And stress just isn't good for DNA or fertility. Rose oil has been used for many different things regarding female balance and female sex organs. So it's one of my favorite oils to recommend. Frankincense is a very anti-inflammatory oil, and we already discussed how inflammation can be a problem. And I think there was a study in rats about how Frankincense helped implantation. If you're inflamed, it's difficult to plant. Sort of like lighting your field on fire and trying to plant your plants can't happen. You want the inflammation in your body to be low. And most oils have some anti-inflammatory, some way they can help. Some help with lowering stress, some help with lowering yeast, some help because they're going to help with bacteria. They all have a different thing, but frankincense in general is anti-inflammatory. And so it would be a great thing to have around. Some women have polycystic ovarian, so they don't ovulate regularly. So instead of having a cycle 12 times a year, they might have a cycle 6 times a year or less. So that's fewer chances to get pregnant. And there's many different reasons people have polycystic ovarian disease syndrome, features, whichever you want to call it. But a couple of things that many people have in common are they're either insulin resistant or they're having issues managing sugar. So the Mediterranean diet is good because it helps diet-wise with sugar. Lowering your stress helps because when you're stressed, your body sometimes produces sugar so you can run faster in response to the stress. Lowering inflammation helps. An inflamed body might not ovulate as readily as a normal, not inflamed body. There are some essential oils that help with blood sugar, cinnamon, ocotea. So a lot of times I'll have people try to include either cinnamon powder or cinnamon oil in their diet regularly to help with sugar balance in their body. Another thing that's been studied with polycystic ovarian syndrome is gluten-free diet. The Mediterranean diet has been studied. So yeah, definitely diet. And a Mediterranean diet doesn't have a lot of gluten in it. They might eat bread sometimes, but it's not a bread heavy diet. So just lowering the amount of gluten could be helpful. And lowering inflammation, lowering toxins, lowering sugar can help with weight loss. Many people with polycystic ovarian syndrome have issues losing weight. There's special cases. Some people with polycystic ovarian syndrome have hair loss or high testosterone. And in that case, I recommend something with saw palmetto. That is what they recommend for men who have issues with hair loss. And a woman could use that. It might help balance her hormone levels and help her function more reliably. And what if a person with polycystic ovarian syndrome had some features of low thyroid or underactive thyroid? Because if someone did have underactive thyroid, they could have a decreased fertility rate, they could have ovarian cysts, they could have breast cysts and breast tenderness. Sometimes supplementing with iodine or a thyroid glandular product could be helpful. Of course, one should ideally be checked by their physician to see if they have clinical thyroid issues, and then they could be treated with the proper medication. Some people simply have the symptoms, and an over-the-counter supplement could be appropriate for them because having low levels of iodine has been seen to possibly affect fertility. Now they think iodine deficiency is rare, but we live in this day and age, we might have different demands for it. Maybe you have other toxins in your body that are affecting how you use iodine or how your thyroid gland is working, and maybe adding to that would be helpful. So optimizing thyroid function. Progesterone support. Again, it's always a good idea to go to your physician and have levels checked and see if you have a reason to take clinical amounts of progesterone. However, progesterone is sold over the counter and in low amounts, not in the amount that a physician would prescribe, but it is available because there's wild yam cream, which does supply the body with a small amount of progesterone, and this could be useful to have. Thank you for joining me for this fertility talk, and please connect with me if you have any questions or need to learn how to order any of the things I mentioned.